Jane, please.
Jane Radio.
Hello, hello, hello. We're back here at Jane Radio. This is Jane Pratt here at SiriusXM Stars 107. And I'm excited because I'm joined here in the studio by Dr. Adam Schaffner. Hello.
Hello. Great to be here.
Thank you so much for coming in. Dr. Schaffner is a New York City plastic surgeon who specializes in aesthetic plastic surgery of the face, breasts, body. And one of the things I liked also just to point out is that you also volunteer your services to help children, injured veterans, and victims of domestic violence who need plastic surgery but lack the necessary resources to have it performed.
Absolutely correct. So it's our pleasure to help those people who are in need.
It's fantastic. Fantastic. So I want to definitely invite people listening to call in here at 888-410-2102 with their questions about what may be the best procedures for them, what may be the things to avoid, what their issues are with their bodies that they would be interested in your expert opinion on. It's basically like, use this as a free consultation, guys, right? You don't get that all the time.
Absolutely correct. Be happy to answer those questions.
With a great New York City plastic surgeon. Okay, so I'm going to start here by asking you, and I have sort of I've mixed feelings myself about plastic surgery that's particularly for aesthetic reasons. I have because I have this thing. I feel like it's nice to be a model of someone just aging the way that I am aging. and aging. I'm 49 now. But I do want to ask you, if I were to come into your office, okay, so look at my face. If I were to come in, I would love to know what you would recommend that I do. I'm not even going to go and give you any more specifics than that, but if I were just to come in, and here we are, and I'm going to use this and get some free help, and please, you do that too at 888-410-2102. Yeah, well, we'll describe it. Okay, so looking at my face, I know which things I have noticed on my own face, but I would love to know what you think.
Well, first, I think you look great. And
good answer.
With that said, I would ask you what it is that bothers you, or what it is that you'd like to see changed or improved. Mm-hmm. And from there, I would go ahead and provide my opinion as far as what things could be done to try to achieve your goals.
Okay, so you don't ever have people come in and you start right in with.
I generally try to avoid that because people could be insulted sometimes from something where I offer the opportunity to change or improve something, and it doesn't bother that person. In fact, they could take offense to the fact that I'm providing unsolicited feedback based on something that they don't perceive to be a problem. And as you suggest, there's nothing wrong with growing old gracefully, mm-hmm. but certain individuals, many obviously in this country and worldwide, are choosing to go ahead and do things to offset the aging process and to look younger and to try to look as energetic on the outside as they feel on the inside.
That's absolutely right. Yeah. I did actually have an experience with a doctor who said, who asked me, a dermatologist who asked me, did he want me to fill this line that I have under my lower lip? And it was I have a line like across my chin, and it was exactly what you're talking about. I was like, no, I like that line. Well, now I have to rethink it. But I'd never had a problem with it before. Let me take this caller, and then we're going to get back to my face in just a second. Amy from New Hampshire. You're on with Jane Pratt and Dr. Adam Schaffner. Did you have a question?
Hi, yes. I have hooded eyelids, and I do not have the financial resources to just go get them repaired or have an eye lift. I've heard that insurance may cover this if it interferes, if the hooded part of the eyelid becomes so severe that it interferes with your vision, perhaps your peripheral vision or something of that sort. Do you know if that's true, and how would you determine that?
Well, it's an excellent question, and the answer is that in certain situations, yes, certain insurance carriers will cover a portion, if not all, of the procedural costs. However, it depends on your individual health insurance policy, the benefits of that policy, and as you suggest, there are certain things that need to be documented in advance of performing the procedure. For the condition that you're describing, it would be a significant interference of the upper eyelid skin in your vision, and specifically obstructing a portion of your visual fields, and an eye doctor could help determine that by performing what's called visual field testing.
Okay, great.
So just so that
Thank you.
I know, and yeah, thank you so much for calling, Amy. Hooded eyelids are when the upper eyelid is it comes down a bit, so that it's sort of I'm just trying to picture what that is. It just comes down a bit over the eye.
Absolutely. So what it involves is a number of different things, and it requires an examination by a qualified physician to be able to determine it, but it can be due to extra eyelid skin, looseness of that skin. It can be looseness of the muscle that's there. It can be laxity of the eyebrow, or a combination of those things.
Oh. So, and I would guess that over time, as you age, it would get more extreme. Right.
If the process is due to aging, then yes, generally as you continue to age, you'll see an advancement in that laxity.
I see. Interesting. Let's take Robin from North Carolina. And believe me, we're getting back to my face because I need your help. You're on with Jane Pratt and Dr. Adam Schaffner.
Hi, your face is perfect, Jane.
Oh, thank you, honey. I love you.
I had breast augmentation probably 10 years ago, maybe 15, I don't know, not too good of time. And the doctor at the time said that my breast, the cleavage can't be enhanced because of the space. And I was wondering if that was him or if that's true. It's not a huge space. It's just a little space, and I wanted better cleavage.
It depends on the shape of your breast and how it inserts onto your chest wall. You have an area there called the inframammary fold or crease, and that's where your underwire would go in your bra. And certain women have a larger space between the breasts where the muscle inserts underneath the skin. It's called the pectoralis major muscle, or your pec. And in some cases, you can go ahead and do things surgically to enhance cleavage, and in certain cases, you can't completely enhance the cleavage to the desired amount. It really depends on the individual.
Sure. Okay. Also, am I supposed to have these rotated, replaced, whatever,
Rotated like tires. That's brilliant.
Yeah, no, there's no mileage requirements on your breast implants. What basically is necessary is that you have routine monitoring of your breasts and your breast implants by a qualified doctor. And in the event that there's any evidence of problems with your breast implants, then they would be evaluated and in certain situations replaced. But as long as the implants are not causing a problem and they're intact, there's no need to replace them. Of course, you should go and have your routine mammograms and other breast cancer screening on a regular basis.
Sure.
So how frequently should Robin and other people listening, how frequently should they be getting them checked? You said get them checked. I mean, aside from the regular mammograms.
So it depends on whether they're saline or they're silicone. Okay. But there are different recommendations for each. But if there's any suspicion of a problem, they should be examined, immediately. If everything appears to be intact, generally for silicone gel implants, the current recommendations are to have an exam by an MRI 3 years after the date of implantation and every 2 years thereafter, and that's according to the U.S. Food and Drug Administration. For saline implants, if there's any evidence of rupture or deflation, you'll note it immediately, because basically it's kind of like a water balloon where it's an all-or-nothing phenomenon where if it's intact, and if it's not, it'll completely deflate.
Okay.
And as far as mammogram guidelines, that's something that I would defer to your, obstetrician gynecologist or who's ever performing your routine breast exams. But they should be performed at least once a year.
Mm-hmm.
Okay.
Okay.
So if I went to have another procedure done asking for better cleavage, it would kind of depend on the doctor and kind of depend on my chest.
That's exactly correct.
Okay. And how do I choose a very good surgeon to possibly enhance my cleavage?
Good question.
That's an excellent question. First, I would recommend that you make sure that your doctor is certified in plastic surgery by the American Board of Plastic Surgery. And I would recommend choosing a plastic surgeon that performs a large number of breast augmentation surgical procedures annually and is very experienced in them to be able to provide you not only with an expert opinion, but to also perform a technically skilled surgical procedure to help achieve your and meet and achieve your expectations.
Okay. Well, that sounds perfect. Thank you very much.
Thank you so much for calling, Robin.
You're welcome. Bye, guys.
Bye. And I thought the same thing as Robin. I thought that I like the way she said, "How often do I have to have them rotated?" But I thought that too. I thought I thought I had heard at one point something about 7 years or something. I don't know why. I don't have breast implants, but I have friends that do, and I thought that I had heard that they need to be changed.
No, they don't have to be changed. If there's nothing wrong with the implant and it's intact, so they do not need to be changed.
Okay.
There's actually something that has come into the news recently, which is an exception to that rule. You might have heard of the PIP breast implants. They were never approved for implantation in the United States by the U.S. Food and Drug Administration, but they were implanted in women outside of the United States, and they're currently advising that those implants be removed and exchanged for new implants. The reason being is that silicone that was used in those implants was not of medical grade. And so that is an exception. But otherwise, if the implants are intact, then they may continue to be in the woman until such time that there may be a problem such as rupture or something else that may require removal.
Interesting. Do they would implants be as likely to sag the same, like is at about the same rate as regular breasts? Like I would think that because they're a little bit weightier, they might sag more quickly.
Implants do increase the weight within the breast tissue and therefore can cause stretching of the breast tissue, thinning of the breast tissue, and that's something that's discussed with the patient prior to placing the breast implant so that they're aware of that risk.
Okay. So that might be why people, maybe that's what I was thinking of, people having them replaced because, or getting lifts or whatever to make up for that.
That's very common, especially if a woman has had implants placed in her 20s or 30s and then goes on to have children, goes through the process where the breasts enlarge in size due to pregnancy and with breastfeeding. And then once they're done having children, done breastfeeding, the breast will oftentimes decrease in size and become thinner.
Believe me, I'm aware, yes. Yes.
And hence the desire for people to have a lift and sometimes even change implant sizes following pregnancy and breastfeeding.
Okay. Interesting. Okay, so I don't want to completely hog Dr. Schaffner's time to myself, although I would happily do that. But no, I definitely want to invite you to call us here at 888-410-2102 with any and all questions about plastic surgery procedures, different things that you could get done to what would you say? To look I like the way you said, to look on the outside the way you feel on the inside.
That's absolutely correct.
Sometimes people probably want to look different on the outside than they feel on the inside too, I guess. So whatever works for you, but do call us here with your questions. Okay, so this is, okay, so I'm going to take off my glasses here and show you that. Okay, so I think that, I have a lot of lines around my eyes, which don't bother me because that to me is an indication of the number of times that I've smiled, right? Which hopefully is a lot in the 49 years I've been around. The lines that I get between my eyebrows is a little bit of a different story because I feel like they indicate that I am worried or angry or just sort of generally unhappy, and they remind me of all the times that I have been worried, angry, unhappy. So I'm not as fond of those. But these lines that I have above my forehead from when I raise my eyebrows, again, I'm okay with those. It means I was excited, right? So yeah, that's my assessment.
Well, those three areas are some of the most common areas for people to have concerns about in the upper third of the face. And what you're talking about are really lines or wrinkles that occur because of repeated motions in those areas.
Yeah.
And the repeated motions are a result of muscles that are in the face, and those muscles have attachments to the undersurface of the skin. And because of that repeated motion, your skin, as it gets older and thins and has sun damage, also has a memory. So whereas an infant can go ahead and smile or frown or raise their eyebrows and doesn't have a crease in those areas, an adult will have creases in those areas. So things that you could consider specifically for the glabellar furrows, or what we call the number 11s, if you will, between the eyebrows.
Oh, yeah.
So you can use Botox, and that will help soften the muscles in that area so that they don't crunch down as much, and therefore you will lessen the depth of that wrinkle. And you can also consider other things as well to help lessen that wrinkle, such as filler materials. You might have heard of things like hyaluronic acids, like Juvederm or Restylane. And you can also consider things like laser resurfacing that will help to rejuvenate the skin by taking off some of the top layer of skin and then let new skin heal from the inside out. And as that happens, the skin tightens, and you also get development of new collagen, and that will help to fill that wrinkle.
Okay. Got it. So I can focus on, if I want to, I can focus on just the ones that are particularly bothersome to me.
Absolutely.
Leave the other ones alone. Okay. Let's take some other callers here. And any of you who have questions for plastic surgeon Dr. Adam Schaffner, feel free to use this as a free consultation at 888-410-2102. Let's take Betty from Massachusetts on line 2. Hey, Betty. Did I say it right? Hey, honey.
Hi. I have questions about droopy eyelids. Looks like I'm asleep all the time.
You're cute. Are you getting enough sleep?
Oh, yeah.
All right. So then that would be a question for Dr. Schaffner.
Have you had these droopy eyelids all your life, or is this something that you've only noticed as you've gotten older?
Always had them. My father had them. My brothers do.
And is it affecting your vision at all?
I don't think so.
Well,
Darn. I guess I was thinking of the insurance.
People always ask me if I'm tired or sleepy because my eyes are drooping.
Well, the first thing that I would recommend doing is seeing your eye doctor. Certain times, if you're born with these conditions, it may be something called ptosis of your eyelids. And if that is the case, that is something where the upper eyelid muscle would be repaired by tightening it to help lift that upper eyelid. If it's in fact the position of the eyebrow or extra eyelid skin or things of that nature, those are things that can also be addressed at the same time.
It's this extra skin. You can pinch it and pull it out like a good inch.
Understandable. So that's not an uncommon problem and something that can definitely be improved.
Is that a major deal with the surgery?
Well, I think that any surgical procedure is something to take seriously, but I certainly wouldn't call this major compared to some other types of surgical procedures, and something that is very safe when performed in an accredited facility by a properly trained surgeon.
Great. Thank you.
All right. Thank you for calling, Betty. We have Janelle from Michigan on line 3. You're on with Jane Pratt and Dr. Adam Schaffner, plastic surgeon.
Hello. How are you today?
I'm good. How are you doing?
Good, thank you. Well, I'm calling today. I'm a really short woman. I'm 4'6", and I inherited very large breasts from my mother's side of the family. They're bigger than a double D, and so I've kind of been thinking, because my blouses never seem to fit right if they're button-down blouses, and I'm just self-conscious. I've been thinking of getting a breast reduction, and I was just wanting to ask what's involved in that and what is the recovery time?
Well, breast reductions are very commonly performed surgical procedures, and what is involved is helping to reduce the overall size of the breast, and in most cases, lifting the location of the nipple and areola as it is still attached to the breast itself. And in doing so, you are able to get a breast which is smaller and a little perkier, and hopefully provides more comfort to you to relieve some of the symptoms of having larger breasts.
Right. Okay. And what is the recovery time for a surgery like that?
Generally, patients can go home the same day. Sometimes drains are placed, and sometimes the patients stay overnight and then go home the next day. But patients generally tolerate it very well, and there's a period of recovery afterwards where you might have some mild bruising, mild swelling, some mild tenderness, and have to sort of take it easy and not engage in any strenuous physical activity for a week or two after surgery. But other than that, you can pretty much go on with your life afterwards, and just after you have a small recovery period.
Oh, well, thank you very much for your information. I appreciate it.
And thank you for calling, Janelle. Do you end up with a scar after that? And where is the scar? Is it underneath?
Anytime you do a surgical procedure that involves an incision, there is going to be a scar. The key thing is to make the scars heal as well as possible and to place them in locations that are going to be as hidden as possible. So for a breast reduction, some breast reductions can be accomplished just by making an incision around the areola. Sometimes it's making it around the areola and then making an incision between the lower portion of the areola down the lower portion of the breast to the inframammary crease or fold. And sometimes it's necessary to extend that incision into the inframammary crease as well.
Okay, I'm trying to picture
That's
where
an
that is.
underwire bra would go.
Oh, yeah, got it. Okay.
So either think about either a circle, a lollipop, or a T, if you will.
Okay. Circle, lollipop, T. Yeah, I get it. Okay. Thank you for that. I want to make sure that Iris, Diane, Linda, hang on. We're going to get to you. Mary Jo from Miami on line 6.
Hello.
Hello, honey. Did you have a question for
you.
Dr. Schaffner? Yeah.
I do. Thank you. I am calling because I am 49 and I'm starting to get like droopy jowls, as they say. And it is kind of hereditary, but it always looks like I'm frowning. And I've been researching those quick lifts that I think they put the string. They use a string just to draw your skin back a little. Is that something that's worth even pursuing more?
It's an excellent question. So there are a number of type of facial rejuvenation procedures that are out there. One that you're maybe referring to is what was called a thread lift at one point, where they use little threads or sutures with barbs on them to help pull up the skin and underlying soft tissue. The problem with that is that sometimes those threads can be seen through the skin. They can become infected. They can extrude or come out through the skin, and they're not really anchored to anything deep that's going to result in a long-term result that I think that you may be looking for. And so I would caution you about that type of procedure. There are many different types of facelifts, mini facelifts, mid facelifts that are out there. And I think the important thing to do is to choose a qualified plastic or facial plastic surgeon who is experienced in performing those types of procedures to help you achieve the goal that you're looking for.
So there is an easier procedure that I can just focus on that one area.
Well, if you were looking for something non-invasive or minimally invasive to help with the jowl region, you could potentially camouflage the jowl by using filler material in front of or behind or both in front of and behind the jowl to help camouflage it. But if you think about the jowl, it's not tissue that you grew with age, it's tissue that fell with age. And so what you want to try to do is to reverse the aging process by lifting that tissue and putting it back to where it once was. And to do that, you need to have a small incision right by the ear, and it's hidden very well right in that crease right there to help do that.
Okay, great. Thank you very much.
Thank you so much for calling. I was trying to picture also if she gained weight, would that fill it out? Because I notice when I'm heavier, I have less of that jowl thing going on.
It camouflages it, but doesn't get rid of it.
Okay, so it's another way of camouflaging. Yeah, okay. Let's take Linda from Pennsylvania on line 5. You are on for your free consultation with plastic surgeon Dr. Adam Schaffner.
Hi, how are you doing?
Doing great. How you doing today?
Oh, pretty good. What I was calling about is I had a breast reduction approximately 3.5 years ago. And the problem I have, I mean, it's not really a big problem, but I have a lot of itching, but it seems like it's under the skin where you can't get at it. Maybe stitches under the skin or something, but I didn't think it should still be itchy at this point. Is there any reason that would be like that, or is there something I should do, or
have you brought this problem to the attention of this doctor who did the procedure?
No, I haven't gone back.
Well, I think that the first thing that I would suggest to you is to contact the doctor who performed the procedure and advise that doctor of your concerns, and that doctor may be able to provide some insight and guidance since that doctor performed the procedure. In general, 3.5 years after your procedure, your incisions are completely healed at that point. And the question that I would have for you, are they raised or red or wide, or any, if you know what a keloid is or hypertrophic scar, is there any evidence of anything like that?
No, none of that.
So, and
it's just, at times it gets so itchy that, you know, and you can't really itch it. It seems like it's under the skin. I haven't gone back. I mean, I did when I first had it done, you know, but then when it healed up, I never did go back again. But, I mean, it just doesn't seem like it should be that way after this amount of time.
Yeah.
There are a number of things that can cause itching in the skin, some of which may be related to your surgery and some of which may not be related to the surgery and may require the expertise of a skin doctor or dermatologist. But I think the great place to start would be with the doctor that you had performed that procedure, and then, if necessary, consider consultation with a dermatologist as well.
Oh, okay.
It really sounds like
Okay,
it makes me itch just to hear you saying it. I want to now start itching, because the idea of something itching where you can't get to it. Be frustrating.
Yeah, it really gets to you.
Yeah.
You want to like squeeze your skin and just somehow try to itch it.
Yeah. Go back to that doctor. Tell him.
I'm going to.
Okay.
Thank you.
Thank you so much for calling.
Okay.
Let's take Diane from Ohio on line 2. You are on with Dr. Adam Schaffner, plastic surgeon.
Hello, doctor.
Hello, how are you?
So formal.
I'm good, thank you. My question is, how effective is ultrasound, or I've also read like microcurrent, for facial sagging or just relaxed, I guess, relaxed face?
Relaxed is a nice way to say it, yeah.
Absolutely. Well, it's a great question. There is new technology that has been introduced into the market to help improve the amount of tissue sagging, if you will, and to minimize that by tightening the underlying structures in the skin. And it is something which has been shown, at least in the short term, to have good results. I think the verdict is still out on whether or not it will provide good long-term results, but it is a positive development in our choices that we can offer to people who are interested in rejuvenating their aging face, and something that's definitely worthwhile as long as you understand that the results of a non-invasive technology like that are not going to be the same as a surgical result from a facelift.
Okay. Would you recommend any particular ultrasound or microcurrent, or I don't know, are they the same thing?
They are not. Microcurrents use electricity, and the ultrasound, you're probably thinking of something called Ultherapy, or made by a company called Ulthera, that uses triangulated ultrasound energy to help heat the underlying tissue and tighten it. And it's really something where I would recommend that you first start with a consultation with a board-certified plastic or facial plastic surgeon to address your concerns, and then they can go ahead and, based on your concerns and their examination of your tissue, provide recommendations for potential treatment options to meet your objectives.
Mm-hmm. Okay. All right, thank you very much.
Thank you so much for calling.
Mm-hmm. Bye-bye.
I love you guys all calling us here, 888-410-202, and being so upfront about what you're going through with your own bodies, and how you're how you're feeling about them. And I like when you use words like "my face is relaxed." It's I like to talk about ourselves in kind ways, right? So that's nice. Yes, as you get older, your face relaxes
Absolutely.
downward. Um, let's take Iris from Oklahoma. Did you have a question for Dr. Schaffner?
Yes, I do. Are you hearing me okay?
Yeah, now we are.
Hello? Okay. Well, I guess mine might be a insurance coverage question. Back in '95, I had breast cancer. I had a mastectomy done on my left breast. Then in '97, I had a transflap surgery.
I think you're a tram flap.
Translap, is that what you call it?
Yes, TRAM. Correct.
Tram flap.
Okay, transflam.
Tram TRAM.
The M in the
flap.
other place.
Yeah, TRAM and then flap FLAP.
Tram flap.
They use part of your abdominal tissue from your tummy region to rebuild your breast.
Yes, correct.
Yes.
Okay, never heard of it.
Well, over the years, my right breast has sagged significantly more than the one that they've done. And I was wondering, usually anything done with because of breast cancer, they will fix. And I was wondering if they would go and lift the right breast without costing me personally, or if insurance would have to cover that.
It's a great question. In general, insurance companies are required by federal law to pay for reconstruction of a breast that has been removed due to breast cancer, and in addition to cover the cost of a procedure to make the other breast symmetrical to the reconstructed breast, or to make the side that didn't have the cancer around the same size and shape as the side that had the cancer from which the breast for which the breast was removed. As far as your insurance carrier is concerned at this point, given the number of years that have elapsed, I think that it would be important for you to see a board-certified plastic surgeon who specializes in breast surgery to provide an examination and evaluation of your current situation, and then to contact your insurance carrier for pre-authorization, and they can potentially work with your insurance carrier to assist you with that.
Okay, thank you very much. I do recommend to anybody who's wanting something like that, it's the best way to go because I still have a really rock-hard stomach.
That's awesome.
Thank you.
You have a great attitude. Thank you so much for calling. Let's take Marcia on line 4. Has an interesting question for you, Dr. Schaffner.
Are you there?
Yes, we are.
Okay. I'm 56 years old. I had a lifestyle lift whenever I was in my late 40s. Got a great result.
Wait, what do you call that? A what? A what lift?
Lifestyle lift. It's below, like, your ear and below to get the lower half of your face and your neck.
Yes, a lifestyle lift is a form of a mini facelift procedure.
Okay. Dr. Schaffner knew. I just didn't.
Oh, okay.
Okay.
And so now we're sagging again, particularly bad in the jowl, and then I have really full lips, which were a wonderful thing at one point, but now I've got, I think they call them marionette creases or something equally irritating.
I've been told I have those too. I know what you're talking about.
Yeah. I had heard about Thermage, and the doctor discouraged that, saying it was real painful and didn't really, result in much difference. So I'm curious, I don't know if I can have another lifestyle lift or if that's what I need to do or what.
Well, I think your question is an excellent one. What you've had in the past is a form of a mini facelift procedure, and in order to evaluate what your current status is, I think it would be helpful for you to see a board-certified facial plastic or plastic surgeon to examine you, and then based on the results of the exam, provide recommendations to help achieve the result that you're looking for, whether it's to help lift that jowl and put it back to where it once was through a surgical procedure, or alternatively to use minimally invasive technologies or filler materials, as you're suggesting, to help fill the marionette lines. And then, as you suggested, there are other technologies that are non-invasive out there, such as thermage, which uses radio frequency or heat energy to help tighten the tissue. It's not going, of course, to give you the same result as a surgical procedure, but can provide some degree of improvement.
And I actually had, Marcia, I had thermage many years ago, and it was it was somewhat painful, but I can't imagine more painful than what you experience after you have the mini facelift, from what I've heard. But it was somewhat painful, but I didn't find great results from it. But I've heard that it's different now. That it's been changed over the years or something.
They have changed their protocol, their tips, and a number of things from a technical perspective to try and improve the technology to deliver a better result.
Mm-hmm.
And with respect to facelifts, most patients who have facelifts don't complain of a lot of pain. What they complain of is tightness in that.
Really?
Is that what you? Oh, that would be your experience too.
Yeah, on the neck in particular, it felt like somebody, was holding your skin extra tight, like you had a problem swallowing and moving your head, and but it looked wonderful.
And you didn't actually have a problem swallowing; it just sort of felt tight.
Oh no,
right?
No. And I was curious. I caught a little snippet on TV a week or so ago about some sort of non-invasive procedure that they said you could do during your lunch hour, and it, gave you a sucked up face for a period of months, and it cost between $300 and $700. I haven't been able to find anything about that online. Do you have any idea what that would be?
I don't know specifically what you're talking about. There's lots of things that are available that can be done during the lunch hour, and probably the best way to find out what's available in your area is to.
What's that?
I said board-certified plastic surgeon. I got that.
Yeah, or facial plastic surgeon. But needless to say, there are a lot of things that are out there that don't require surgery that can help improve your facial appearance. But I'm not aware specifically of the segment that you're referring to.
I like I like the way you put it, though, Marcia. Like it's all because it's always on your lunch hour. It's always what you can do on your lunch hour, right? And then also these.
Pay for the damn thing.
Exactly. And then you're like, it gives you a sucked up face for a few months.
Exactly.
But I can't find that online when I try to Google the sucked up face in lunch hour.
And everybody says, "You look wonderful. What happened? Did you lose weight? Did you get a nap?" No, I'm not late. No, anyway.
Yeah.
Okay, great.
Thank you for
Thank you
calling,
much.
Marcia.
Sure.
I like that too. That's the thing people always go for, right? Is to look like, oh, you look so well rested. Did you just have a vacation or whatever? That's what people are.
Well, I think that's a sign of good plastic surgery. If someone can say, "Wow, what happened to your face? Did you have a facelift, or did you have a nose job?" I think it really reflects that there's something that's distorted or abnormal. But if someone can't tell that you've had plastic surgery, but thinks that you look rested, rejuvenated, refreshed, I think that's more of a sign of good plastic surgery.
Let's take Cammie from Colorado on line 3.
Hi, you guys.
Hello.
How's it going?
Good.
Okay, so I had a tummy tuck last March, so it's been a year. And the incision, of course, goes from hip bone to hip bone. And I'm also an avid cyclist. And so when I would cycle and work out, I would be sort of hunched over a little bit. And so I don't know if that's why the muscles around that are so tight. And especially when the weather changes, it seems like they just almost spasm. I'm wondering if you would recommend Botox or something to relax those muscles around there. I don't want to take any sort of muscle relaxer because that kind of affects your whole body. But, I mean, I can do yoga and I can get the muscles to relax if I do things that oppose that sort of that tuck position in cycling. But it just seems like it's constantly tight, and it's been a year.
Have you gone back to the plastic surgeon that performed the procedure and advised the doctor of your concern?
I have. And they just say that that's what it's supposed to feel like, that's what it's supposed to be like, and I am going in for a second opinion next week, but since I heard you on Cute Jane's station,
Aw.
and I thought I would call and see what you thought about it, if you've heard of that.
Yes, I have certainly heard of individuals who, after a tummy tuck, note that the area is quite tight. Oftentimes, it will loosen over the course of the year following the procedure. You're obviously at this point right now, and I think it's not a bad idea for you to get a second opinion just to see what that doctor thinks. I am not familiar with anyone using Botox in the stomach muscles that are the rectus abdomini muscles, which are the muscles that are sewn back together during a tummy tuck. To help minimize or to get rid of the space in between them that can develop with age and pregnancy and things of that nature. But I think that that's something that's definitely worthwhile exploring. The other thing to explore is whether or not the problem is something other than the muscles themselves. Could it be the scar tissue that's there over the muscle and under or within the skin? And could that be playing a role in this as well?
Now, is it something that I should massage? I know, because I also had implants at the same time, and the implants didn't work, unfortunately. On one side, I had a Baker grade 4, and then on the other side, it bottomed out, so I had to do them over. But I did spend a lot of time popping scar tissue on my breasts. So is it, I don't know, it's very different. I don't know if anybody has had an encapsulation on their implant, but I did, and I had to work on it. It took about 6 months to get that thing down, but it doesn't feel the same.
In answer to your question, bottoming out and capsular contracture are potential complications of breast implant surgery. And for listeners who are not familiar with this, what we're talking about is a capsule that can develop around a breast implant, which is completely normal, but what's not completely normal is for it to tighten around that implant. And what you're describing, a Baker 4, is the most significant or severe of the grades of capsular contracture. So I'm sorry that that happened to you.
Thank you.
And as far as the bottoming out, that's where the implant goes below that crease, the inframammary fold, where an underwire bra would be. And so with bottoming out, you need to do things to lift that implant. And with the capsular contracture, sometimes it's necessary to remove the capsule and replace the implant. I don't know whether or not they did that for you or not.
No, I brought the encapsulation down by myself, but they had to redo the bottoming out. They put some Alloderm or some in underneath it and to the side to prop it back up. So it's been kind of a journey. And so I'm not sure. I don't know. I mean, I don't know if I would recommend doing these things. Maybe it does take longer than a year to get all of this stuff to settle back down. I had my second the implant correction surgery in September, so it has been only 6 months from that, but it's been a year for my stomach, and it still is just not well.
And one of the things that hit me when you were talking, Cammie, is that you sound like you're in amazing shape, right? You cycle, you do yoga, all this stuff, and it sounds like. But what was the tummy tuck was for? What?
I've had 3 babies,
I thought
5 pregnancies and 3 babies, and so it was completely separated. And then I just had a very, very skeletal upper body. And so I wanted to get the implants. I really did go. I think it looks wonderful. They're only 300. They're very appropriate for my frame and for my body. 300 is pretty small cc's for the implant. But so I think that in theory, my procedures should have worked lovely. But I'm still trying to see that, especially with this stomach thing.
Yeah.
I certainly understand your concern, and it sounds like that you've gone through quite a journey here. But I think that getting a second opinion from a plastic surgeon would be of significant benefit, and I think it's important that you tell that plastic surgeon about your entire surgical history here, so they're aware of the scar tissue formation that you've had in other areas, and they could potentially evaluate that area for scar tissue development as well.
So would you pop the scar tissue around the stomach like you did, like a person would around an implant? Is it the same sort of pushing and kind of yanking, and is that how you would do it around the stomach? Or
gentle massage potentially. What you're referring to with rupturing scar tissue is generally not something that's recommended either in the abdomen or in the breast region, for that matter. Something where I think close counseling by a plastic surgeon who's experienced in these procedures is going to be something that's going to be quite valuable for you.
Okay. Thank you so much for your advice.
Thank you so much for calling.
Okay. Bye.
Let's take Jody from Alabama on line 5. You're on with Jane Pratt and Dr. Adam Schaffner, who, by the way, you can, if you're liking his advice, which is, I think, awesome, you can check him out further at drschaffner.com. It's DRSCHAFFNER.com. So that's good to know, too.
Hi, Jane.
Hey, Jody.
And Dr. Schaffner, I have the line that you mentioned before under my lip and below my chin. I call it my little sinkhole. I have a very prominent chin, and that's one reason why, the little crease forms there.
Oh, under the chin. I have that one, too. I was talking about the one between my chin and my lower lip, that I have a line across there. But
okay.
I have one where you're talking about, too, so I know what you're talking about. Yeah.
Okay, so I wanted to ask about a filler for that or potentially a chin reduction. I have a really prominent chin. It's kind of a witchy chin. It's not like a strong jaw like Jay Leno. I'm a very thin woman. I'm 40, and it seems to be getting witchier as I age.
Well, it's a great question and something which does affect many individuals. And I think it really depends on what the underlying cause is. And it may be a combination of things. It could be laxity of the skin and the overlying soft tissue. It could be a laxity of the muscle that's there, and that needs to be tightened. It could be that there's a lot of extra fat that's underneath the chin that could be removed. So there's a lot of different options for treatments, but it really depends on what the cause or causes are.
Okay. There's no fat. I'm very thin and fit. I'm a fitness instructor. It's actually my bone. My chin bone is just, always been very kind of prominent, I guess.
Mm-hmm.
And certainly you can have a very prominent jaw bone or mandible, and if that is protruding or coming far out, sometimes it's recommended to reduce that area, but that is not in a minor procedure and something where you would need to have that performed by a qualified physician.
Yeah, that's what I was thinking. So the filler, would you recommend Restylane or Perlane or something in that little, what I call the sinkhole between the bottom of the lower lip and the top of the chin?
Oh, that one.
So, right, yeah, that's a great question. There are a number of different fillers out there. Hyaluronic acid, such as the ones that you mentioned, are excellent for that area. There's other filler materials that are available as well, which are excellent. And I think that it really depends on your desire and the recommendation and skill and experience of the doctor that you're working with, so that together you choose a filler that is going to give you the best possible result.
Okay. Awesome. So there's not a particular one that's better for around the mouth or...
The hyaluronic acids that you mentioned, such as Juvederm, Restylane, and Perlane, are all excellent.
Okay. Great. Well, thank you so much.
Thank you so much for calling, Jody. I'm sure it's much more common to get people wanting the chin, more of a chin rather than less of a chin, right?
I would agree with that, absolutely.
Yeah. Jody is a doubly blessed, or however you would say that. We are going to have to take a quick break here. Will you stick around? Okay, definitely want Laura, Kat, Karen, Jewel, Carol, all of you calling here for Dr. Schaffner to stick around. We'll be right back here at Jane Radio. And please do also check out drschaffner.com. It's SCHAFFNER.com. We'll be right back.
Jane Radio.
5 boyfriends in 5 different parts of the world. That, to me, is happiness.
Jane!
Hello. We're back here at Jane Radio. This is Jane Pratt, and I'm joined here by the lovely, and so incredibly helpful Dr. Adam Schaffner. And I want you to, he's here in Manhattan. He's based here in Manhattan, although you are getting his wisdom all around from wherever you are. And I want to give you also his phone number here. It's 212-688-6600. And you can also check him out at drschaffner.com. It's SCHAFFNER, drschaffner.com. Let's take as many more calls as we can fit in here. Jewel from California on line 4. Did you have a question?
Yeah, I do.
I am wondering about, I've heard to never do lower blepharoplasty. I will be turning 50. And my eyes, I would say, is what gives me away the most. Everything else seems to be in pretty good shape. And so I had a doctor talk about a full facelift and upper lower blep, but I'm wondering if there are other options, like maybe cheek implants or lasers that could work as well.
Excellent question. For those who are not familiar, bleph is short for blepharoplasty, which is upper and lower eyelid surgery, and it really depends on what it is that bothers you about your eyelid region. And for things such as extra skin or fat that's pooching out from underneath the lower eyelid there, generally surgery will be something that can help that. If it's fine lines, wrinkles, discoloration of the skin, things such as filler materials, Botox, and lasers can certainly help improve the appearance from that perspective.
Cool.
Oh, good to know. Now, would cheek implants totally reshape the face?
Well, when you go ahead and put an implant in someone, you're increasing the volume in the area where you're placing the implant. So that will go ahead and change the shape of your face. If you have a very narrow face or your cheekbones aren't as prominent as you'd like them to be, then cheek implants are something that you may want to consider. But I would not go ahead and recommend placing cheek implants to help improve the eyes.
Okay, good to know. Thank you so much for calling, Jewel. Let's take Kat from Arizona on line 2. Kat, did you have a question for Dr. Schaffner?
Yes, I do. This is a great show. I love this stuff. Great show. I'm 68 and I'm really in good shape, but I won't wear short sleeves. My skin is crepey, and here living in Arizona, I sure would love to wear short sleeves occasionally, but I won't because of the crepey skin. Is there anything that you can do for that?
Well, crepey skin is always a challenge. I think especially in an area where you're getting a lot of sun exposure, key things are going to be minimizing sun damage to your skin. Damage from the sun is something that causes a lot of crepiness in the skin. So things like using sunblock, SPF 30 or higher, frequently applying it, moisturizer, clothing that's going to protect the skin, and just avoiding the sun in general. Of course, none of that's going to significantly change the skin that's already crepey. And for that, you can consider laser treatments that may help to rejuvenate the appearance of the skin. You might have heard of things like fractionated carbon dioxide laser resurfacing, or things like Fraxel or the Affirm laser. And then if there's extra fat in that area, there's also lasers that can be used underneath the skin to help tighten the tissue as well.
What would a laser for under the skin, what would that be?
You might have heard of something called Smart Lipo, and there are other basically that and other types of similar devices will use heat energy through a laser underneath the skin to help tighten the tissue that's there, and it is something which you can result in improvement of the appearance of the skin, especially if there's extra fat in that area and you'd like to address that at the same time.
What about that cold, or that I hear where they're doing a freezing laser or something? Do you know anything about that?
You know what? I think we're going to have to get to that another time because we've run out of time here with so many of your good questions. And I want to thank you so much, Dr. Adam Schaffner, here in Manhattan at 212-688-6600. Please check out also his website, drschaffner.com. And Cammie, who called earlier from Colorado. If you want to send us a note here at janeradio@SiriusXM.com. We're going to pass that information along because Dr. Schaffner can help you out with some referrals there. Thank you all so much for being here with me. What I learned today on Jane Radio, Jane is going to perfect her lying techniques. You can't get sunburn through a window, so don't use that lie. Jane likes the line on her chin. Jane would accept almost any excuse for being late to work, especially sex in the shower. And you can look on the outside the way you feel on the inside. We'll be back here with you same time, same place next week on Jane Radio.